Polycystic ovaries are characterized by increased volume of ovaries on both sides. It is almost always more than 10 ml. Normally should be less than 10 ml. Another word related to 10 is more than 10 number of follicles present on single view, and other 10 is that all the follicles should be less than 10 millimeter in diameter. It can be also called rule of 10. These are small follicles arranged around the central thick echogenic stroma. All follicles arranged at the periphery with thick echogenic stroma. So increased number of volume, increased number of small follicles less than 10 millimeter. Transvaginal scan, transabdominal scan can also be helpful in some occasions with good probe handling. This is ovarian stroma and peripherally arranged these black hyploid small follicles. These are follicles peripherally arranged, and in that, if we look at the endometrium, it will be echogenic. Typical trilaminar appearance is very rare. It is echogenic, peripherally echogenic endometrium, and in the ovaries peripherally arranged small follicles. All are less than 10 millimeter in size. No dominant follicles seen. This is there. Peripherally arranged follicles. No dominant follicles seen. And in the end, we can see there, we will see on the transabdominal ultrasound follicles arranged at the periphery. This is a transvaginal scan. Echogenic endometrium. This is there, echogenic endometrium. Echogenic endometrium. And when we will come to the ovary, we will easily find number of follicles and thickened stroma. Still, this is myometrium in the uterus. Endometrium is echogenic. Myometrium is clear. Patient will have clinical signs symptoms like obesity, hirsutism, oligomenorrhea, and most importantly, most of the cases will come to you with infertility, primary, secondary, subfertility. Majority of the female will be obese. Now we are shifting transabdominal ultrasound. This is another patient. These are the ovaries visible on transabdominal ultrasound. Left ovary, follicles peripherally arranged. This is someone else patient. This is another patient. These are follicles. We are now performing transabdominal ultrasound. Of course, transabdominal ultrasound is there. We can also perform Doppler of the ovarian artery. Blood flow resistance and blood flow pattern can be measured. But this characteristic appearance of increased number of follicles less than 10 millimeter ovarian size is easily appreciated, especially on transvaginal scan. and with history and clinical findings you can easily reach your diagnosis. Thank you very much.